If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, what are the common symptoms of type 2 diabetes? Answer by Venkatraman Radhakrishnan. India is the diabetes capital of the world. Type 2 diabetes or insulin-resistant diabetes is a silent killer. Many people never realize they have diabetes before significant organ damage occurs. The common signs and symptoms include: in late stages, diabetes is an independent risk factor for heart attack and stroke. Metabolic syndrome. Diabetics are also more prone for cancers. Diabetic ketoacidosis, DKA, is a life-threatening medical emergency caused by very high sugar and dehydration. Patient can become comatose, have seizures and have rapid breathing. Many diabetics discontinue medications abruptly without their doctor's advice as their blood sugars become normal. These patients may come to the emergency with DKA. Prediabetes or mild diabetes can be controlled with diet and exercise and weight loss. A recent study showed losing 15 kilograms weight can completely reverse diabetes. Losing weight can reverse type 2 diabetes, but is rarely achieved or recorded. Answer by Thomas K. Reed. Type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar, glucose. The signs and symptoms of type 2 diabetes often develop slowly, hence it's important to ensure you take care of your body and be constantly aware of its symptoms. Increased thirst and frequent urination. Since excess sugar builds up in your bloodstream when suffering from type 2 diabetes, fluid gets pulled from the tissues. This can probably leave you thirsty, and as a result, you may drink and urinate more than usual. This symptom often goes neglected, so please keep an eye on the frequency of thirst and urination. Increased hunger. Less insulin moves sugar into your cells, so your muscles and organs become depleted of energy. This can seemingly trigger intense hunger. Weight loss. Though you may eat more than usual to relieve your hunger pangs, you may end up losing weight. Since there is no ability to metabolize glucose, the body utilizes alternative fuels stored in muscle and fat. So, calories are lost as excess glucose is released in the urine. Blurred vision. If blood sugar level is too high, fluid may be pulled from the lenses of your eyes. This can probably affect your ability to focus. Fatigue. As your cells are deprived of sugar, you may become irritable and tired. Slow healing. Sores or frequent infections. Your body's ability to heal and resist infections will be grossly affected if you suffer from type 2 diabetes. Areas of darkened skin. Some type 2 diabetes patients have patches of dark, velvety skin in the folds and creases of their bodies, usually in the armpits and neck. This condition is called acanthosis nigricans, and may be a sign of insulin resistance. If you have noted one or more of the above symptoms, please visit your doctor immediately. Your doctor will request for a blood test to confirm whether you suffer from the condition and will also update you on the currently available type 2 diabetes treatment and diabetes medications. Answer by Amit Sharma. Basic symptoms of type 2 diabetes. On the off chance that you have diabetes, it can see how your glucose levels influence the way you feel. Most basic side effects of diabetes are caused by hoisted glucose levels. Visit for increased urination. Raised glucose levels can strain liquids from your cells. This builds the measure of liquid conveyed to the kidneys. This influences you to need to urinate more. It might likewise in the end make you dried out. Thirst. As your tissues end up got dried out, you will wind up parched. Expanded thirst is another normal diabetes manifestation. The more you urinate, the more you have to drink, and the other way around. Weakness. Feeling exhausted is another regular side effect of diabetes. Glucose is regularly one of the body's fundamental wellsprings of vitality. At the point when cells can't assimilate sugar, you can end up exhausted or feel depleted. Obscured vision. For the time being, high glucose levels can cause a swelling of the focal point in the eye. This prompts foggy vision. Getting your glucose under control can help redress vision issues. On the off chance that glucose levels stay high for quite a while, other eye issues can happen. Repeating infections and sores. Hoisted glucose levels may make it harder for your body to mend. In this way, wounds like cuts and injuries remain open longer. This makes them more powerless to contamination. Here and there, individuals don't see that they have high glucose levels since they don't feel any indications. High glucose can prompt long-haul issues, for example, a higher hazard for coronary illness, foot issues, nerve harm, eye illnesses, kidney illness. Individuals with diabetes are likewise in danger for genuine bladder diseases. In individuals without diabetes, bladder diseases are normally difficult. In any case, diabetics might not have that impression of torment with pee. The contamination may not be identified until the point that it has spread to the kidneys. Crisis symptoms of type 2 diabetes. Check it on Rishad Diagnostics, Diagnostic Lab in New Friends Colony, Delhi. Librate is expressed. High glucose causes long-haul harm to the body. Be that as it may, low glucose, called hypoglycemia, can be a therapeutic crisis. Hypoglycemia happens when there are perilously low levels of glucose. For individuals with type 2 diabetes, just those individuals who are on pharmaceuticals that expansion the body's insulin levels are in danger for low glucose. Side effects of hypoglycemia include shaking, wooziness, hunger, cerebral pain, sweating, inconvenience considering, touchiness or crankiness, quick pulse. On the off chance that you are on medications that expansion the measure of insulin in your body, make sure you know how to treat low glucose.